Uh, Dr. Ong, thank you for your patience and for your willingness to be with us today. I have the distinct pleasure of introducing Dr. Myo Niang Ong. He is an associate professor at the Juntendo University in Tokyo, Japan. His current research is community integrated innovation for healthy aging and health promotion in Japan and in Thailand. He is a public health researcher experienced with health promotion intervention trials, prevention of non-communicable diseases, and infectious diseases. Dr. Ung teaches research methodology for graduate students in global health class, public health class, and clinical epidemiology classes internationally. At Juntendo University, he teaches social policy for aging in Asia and field research in global health. And Dr. Ung has provided a link in the chat room to the research paper he will be presenting. His topic today is sustainable health promotion for older people in Japanese communities in the era of COVID-19 pandemic. I'm very excited about this presentation. It brings us now around to a patient-centered focus and also builds upon the health promotion that we have been talking about for the past day and a half. Dr. Ong.
Thank you very much. Thank you very much. Hello, can you see my presentation?
Yes,
PowerPoint.
we can.
Okay.
Yes, we can see it, doctor. Yes.
Okay. So thank you very much for introducing me, Dr. Donna. So as she has already presented, I'm a associate professor at the university where I'm teaching. Is you can see in my background, which is the oldest medical school in Japan, and we are like at the heart of the Tokyo, which is called the Juntendo University. So at first, I would like to introduce my university. I'm mostly working for uh, the research in older populations. So today, I will talk about collection of experiences and finding in the sustainable health promotion for the older people in Japan, this project. And at the same time, I have been doing a cluster randomized trial for the new long-term care system in Thailand. And if possible, maybe I will share some of the photograph to you. And here in this picture, you can see four of the my participants. So this picture was taken in this year, December 2020. So this location, it is called the in Japanese language Tempopo sunflower saloon. This place is called the Sunflower Saloon. It is a regular place, a place for regular meeting of the seniors in the community. And that was, very, I was very worried because this is a COVID-19 era, but just before the third wave is very serious. So I conducted the last interview with this for the older persons. So they all know me very well. And okay, so today is the content will include. I will talk about some of the impact of the COVID-19 pandemic and aging in Japan, and some of the principles related to the health promotion, and then the age-friendly environment and how we sustain the health promotion for the seniors during COVID-19, and the challenges and the discussion. So um, at this moment, it's very good opportunity you have invited me here because I'm writing. I just finished the wrapping up of one article to submit to the gerontologist by invitation, which is the integrated finding of the qualitative, quantitative, and fee observation. I hope that it will be interesting for you. And so at first, well, let's see how serious is this pandemic is. In Japan. So we experienced three waves. Three waves. The last wave was the most serious. It just going down to have 1,000 new cases every day. So at this moment, so when you see those peak in the March, in around August, September, and around December. And I would like to inform you that those time were a very hard time for keeping up the health promotion activity. So we learned a lot from the previous speaker. She has explained us how our mind can can release kind of stress and anxiety by practicing the exercise. So she has highlighted this, and so you can imagine that in this pandemic period, so we have a very huge anxiety and stress, especially those who are over 70 and 80, how they will feel it, and regular activity. So those activity I will introduce all stop because of the emergency declaration of this COVID-19 pandemic containment. Then you can see in Japan, the number of the infection is 340 per 100,000 compared to the United States. It looks like the intensity of the infections is much less than the United. However, there are another important factor is the demography. Demography. Japan is a country which has the oldest the population in the world at this moment. If you see Japanese people, in generally 1 out of 3 people are over 65, and if you look at the household, 1 out of 2 household has over 65 years old aging person. Okay, so this was the very early in the first wave of the pandemic. So we saw the impact of the health inequality, COVID-19 as the health inequality. If you see, compare the lower income country, lower and middle income country, upper and middle income country, and high income country, you can see the red one is the number of people who died, and the left blue color is the number of the cases. So that means that there are huge difference between the country with the different economic status. So at first it was very obvious. This analysis was conducted in the exactly years before March 2020. At the time when the ratio first declared as a pandemic a little bit lately. So in that time when we in the very early phase of the COVID-19, we can see the inequality in terms of healthcare outcomes. Then, the pandemic proceeds uh, around the world, and its affects not only the life of the people, but also is bringing so many social and economic impact. So many, as you know, so many schools stop around the world. People cannot go, children cannot attend the school. So many people lose their job. And as a health promotionist, we are thinking that the pandemic has reached to affect the social determinants of the health. So which is basically the education, economic stability, and healthcare, and also social and community context, neighborhood and built environment. So those things are actually very important for our daily life. So at that time, we are really, the whole year we are very much pressure for saving the people life at the hospital. At the same time, what is the new normal life for us, and how we can sustain our livelihoods is a very high pressure for general population. So at this situation, I would like to introduce you the population of Japan. If you see in the middle, and then, I want you to see these figure. There is a blue line, the blue dotted interrupted line. Above those is the population over 65 years old. If you compare world population, the United States, Japan, Republic of Korea, and China, and then you can see the population above and below. Japan is the under 65 population is getting less and less. Population is declining, and the over 65 population, as I talk to you, so quite more and more people in coming a few years. So it will be 1 out of 3 Japanese people will be the old people. At this moment, 28.4%, and they call it the super aging society. So that in Japan is a lot of the hospital. So in the third wave, hospital overburden rate is reached to more than 300%. So the a lot of the every day besides my house, I hear the siren of the ambulance day and night. So because of the large number of this old population, so at that time, at the start of the pandemic, I was still conducting this research. And we know that the emergency situation will be declared, so that we are really worried about how we can sustain our activity. So then we could do something just before the declaration of emergency. I will show you. And okay, and then introducing a little bit more about the Japan. This country is well known for the long time, more than 20 years of the universal health coverage, and it has a successful long-term care insurance system. In 2017, they start to idealize the new system, which is called the community-based integrated care system. The idea is that people are accessible to the medical care, nursing care, preventive care, livelihood support, integrated in the communities where they used to live. This kind of the idea is also well known as the aging in place. I think in the United States they call aging in place, but here aging in place plus the services can be accessible to the older person at home. Okay, then let's look at the age-friendly environment. This survey was, in fact, there's a small survey we carried out in 2019. So if you look at walkability, public spaces, public transportation, public stops, affordable residence, the rates, the response of the older person over 80%, 85%, 90%. So that's show the physically this environment is okay, and it's very lively for the older person. And you can see some of the features. This park is a small park, and I'm lucky enough to walk across this park whenever I go to my study site. So it is in one of the small park situated in Tokyo, and I would like to show you the walking pedestrian lane and how older person can walk. Then this place is another place which is near the this place is called the shopping streets for the older person. So you will see the platform and non-steps are easy to step on the bus, and there are white lanes for the older people. And another one is the social inclusiveness. So when we look at the community, they feel that they are respected. And then, one point is older person engaged in the volunteer activity. This photo shows that the one senior is working as a volunteer. So it is the school time. So when the kids go back from the school, they cross the road, and those older person work as the traffic guides. So this is called server volunteer. So but you see, this activity is only 52% of the older people they can engage in this activity. And employment rate for the older person age above 65 is 33%. And social and cultural activity 64%. This point is very important. Social and cultural activity, please keep a note of this activity. And the decision making 70%. Later on, the E9 is turned out to be a factor which is related to the prevention of the dementia. And the engage in the volunteer activity is a factor which is turned out to be the factor which enrich the social network of the older person in the later analysis. So, and then, this slide will show the care services, mostly care services. So around their house, around their living place, information for the services and care and assistance services are available. So more than 90%, we can see that their income, the financial security, 82%. They said until the last month, last year, they do not have any problem for this. And the parking places, this parking is bicycle parking, not the motor car parking. And in that, there is a gender difference. Actually, all of those bicycles belongs to the grammars. But in the survey, they say that they are less than the gentlemen. They got the priority parking place, so less than the gentlemen. So I want to show you. They came to this health center riding a bicycle. So most of the people are over 70, over 80. So this is a parking place at the public health center. And then the public transports, as you know, this is a country of train, and so many train and buses are available, and many people say that they are near the bus stop. Okay, then okay, I would like to show you another one. Now I will start to talk about the setting. And here is on the second floor of a clinic. So usually about 30 people. This is a primary healthcare clinic. So this was 2019 December, just before the pandemic. So this exercise was sustained for 20 years. It has been 20 years. So people have been meeting there and doing a kind of group exercise. So when you see that leader, and she is not a professional trainer, she's a volunteer from community. So she has received such kind of training. We call it the functional training exercise. That's prevent the frailty of the older people. And then, it's not a very hard exercise. So this is one model, you can see that. And the second is the common room of the apartment for the older person. Here, this model has, they don't even have a television. And normally, every week, participant about 30 people, and this place, exactly this place. So at the time, when I see those senior, they are very active. If they came here, some on foot and bicycle, and until the pandemic was announced, so they can go freely, and we really enjoy the a very good livelihood. Yeah? So you can see this, and in the middle standing is the leader. They say that the leadership is very important. They are inspired by the trainer. And then the age-friendly environment. If you look at this, such kind of participation in the group exercise, 74%, and the enrollment in the education, and so 49%. They feel very safe in their neighborhood. Emergency response, 53%. But here one point, home internet access. So in my study, 59%, but in the national statistic, a little bit less than this. Okay, so another one I want to show you here is in the community. If you see the road sign, in the walking distance, there's a sports center, nursing home, and the community health center, yeah, daycare center is in the walking distance. So such the environment is here. And so at that time, so because of the coronavirus, we have to secure hand washing, wearing the mask, and the social distancing. In fact, in Japan, hand washing is also very common, and then the wearing the mask is also not very strange for the people. We can easily, promote this behavior. However, social distancing is not common to any countries. I think that nobody want to stay away from each other, and social isolation is very risky for the older the population. So why we have to do this? Because we are afraid of the uh, the pandemic and the to control the epidemic curve. So at that time last year, coming soon again in March and April, Sakura festival, Sakura cherry blossom. So the nature of the Japanese people is sitting under the Sakura tree and they look into the Sakura, talking to each other, eating something. So such a the very huge culture is here. I would like to welcome all of you if you are interested. Please join my study, and so we can really involve in the community and see the culture and society. So that time, in my studies are in Thailand, Myanmar, Malaysia. They also have a religious New Year festival, Ramadan. So that COVID-19 control encourages social distancing. So public health action is opposite to the cultural values at the time. So it's quite a big conflict. So how we do this, so it just makes me think about the intervention in health promotion. Number one is the social change, the empowerment, education approach, behavior change, medical approach. So medical approach is, I think, is very common to all of us because we are in the medical field. The social change, we can see the political leaders such as the prime minister, the Donald Trump, the president. So such the people, they directly leads the outbreak controls and release the emergency declaration lockdowns. Right? So such thing is called the social change. So, but the social change, another thing, second thing is empowerment. Empowerment means when people want to wash their hand, are there any washing facility at their hand easily? So that's different in different countries. So how we can make the people able to wash their hands, so to have a knowledge, attitude as well as the facility and capacity. So then education approach is also very important. So we're thinking that with the increasing uptake of these protective behaviors, the pandemic will be controlled. We're thinking that at the time was the vaccine is still in the trial, but we refer this as a social vaccine. So for example, like this is a very famous in Western Pacific region, 3C. 3C is the if you should not go to the crowded place, please avoid the close contact. And so this 3C is very successful in Japan. However, in Manila, in Philippines, they question that is it an elite policy? It is not possible for the Philippine population to practice that. So that the community empowerment at this point is very important it for the outbreak control as well as for the healthy behavior. So when we are worrying about the infectious diseases, we also at the same time we are locked in the house, so movement are restricted. So that another problem came to us is the social evaluation threat. That's a mental problem. I think the previous speaker, she has mentioned this very well, and thank you very much. And so we are facing with the obesity, frailty, this crisis. In fact, why this is the physical inactivity, how we can move the people. We have to think about this. So the paradigm became two in the presence of the determinants of the health. One side is social distancing, cough etiquette, hand hygiene. So another side is the please promote the physical activity, eat carefully, and please don't drink too much, stop smoking. So these two have to be balanced. And then and, this is the picture. Sorry, this is the picture showing that Ottawa Charter, health promotion, the area of actions. So number one is the public policy from the government. Number two is creating supportive environment. And number three is strengthening the community action. Number four, personal level, the skills and education. Number five is reorientating the services. In fact, we think about this way of thinking is very much easy to follow the how we are building going to the new normals. So and this is one of the pictures from Thailand. It's not from Japan. And in Thailand, the population aging is on average of they are younger, 10 years younger than Japan. So in the second wave in this project we bring a care prevention exercise for the older people in Thailand. So we bring the expert, we bring the equipment, we bring the community-based idea to make them active aging and the prevention of the long-term care costs. So this is one of the example of the empowering the people in the community. So why I mention it here is that Thailand is recognized as the example by the World Health Organization to control the COVID-19. So you can see the health volunteers. And these are not professionals; they are volunteers. The volunteers are screening in the community, controlling the outbreaks, in terms of the fever screening and the social community-based model, so that they have experience, more experience than Japan in terms of the infectious diseases in Thailand. So they got to control very quickly. And at that time, in my project in Thailand, have a community exercise program, and but it's also cannot be organized because of the COVID-19. And then I was very surprised of the local people. They form a group with the line, a kind of mobile apps, and people are introducing the we have a home exercise, not only the group exercise program. Home exercise, when in the article I shared to you, there is a 7 set of exercise for 7 days, and every day we just have to do 10 minutes, and it can have a sufficient level of physical activity and different set. We have been making ready for this project. So we what we do is we change this to be in the Japanese language, from Thai language to Japanese language. So I will introduce you here is a all clinic in Japan. In Japan, primary healthcare clinic, and this clinic is, as I talked to you, this clinic is announced today no longer a clinic. It is a place for the older people. The name is called Sunflower Saloon. What are they doing here? So like this building. So they are over 80s, all of those participants. So this place is a place where they can do whatever they love to do. So I joined one day there, and I remember that in the morning, the 10 o'clock to 12, they are repeating two round of exercise. And at the time, somebody is cooking these dishes. And we got the smell, flavor of the food. And after that, we eat this together. And then they collect about $2, $3, about that money to contribute to the sustainable the activity. Other for the space, for the electricity, everything is made freely available by the cooperatives. Cooperatives. This cooperative is also invested by the older people. So this activity. And this is I talk to you. Please remember the social and cultural activity. So if you read the many of the Japanese literature, they will say the saloon. I think they directly translated. This house previously belonged to a writer, and this writer passed away and leave the house for the public, and the older person can enjoy this house as for the place for the meeting. And on the interview, I asked her, what is the best memory of this? So 89 years old man said, I still remember the flavor of the barbecue. We make it in the garden. And many young children join this. Even salary people join it here. And it is, kizuna is mean that's the attachment. Like people become attached to each other, the bonding and socially cohesive community was. So in the city of population about 300,000, there are about 30 places like this, small places that is it. So participating in such a, saloon, what they do is like this. This is a called Majan. So some people are, they don't like to exercise, but they want to join Majan in the afternoon, a morning exercise after the lunch and after the Majan. Some are, you can see the trophy, Majan champions. So such kind of activities are a lot. So many kind of Majan, origami, yoga, the harmonica, knitting. Some people read the book aloud. So those are the I would say these are the community developed idea rather than community based. So they just make according to their hobby. So people who have a similar kind of hobby come to meet regular. So in this pandemic, until now, these activities all have to be stopped. So that you can imagine that how much the people became housebound and socially isolated. This will happen. So what we did, what we tried to restore it in the 2020 March, we make a home exercise, and we know that many people do not use the internet, so that we prepare the DVD and a poster and a calendar, and we distribute it to the community.
だとすれば、その間も私たちの暮らしと雇用と暮らしは何としても守り抜いていかなければなりません。
So he said that we have to sustain the normality, new normal, to have our previous normal life. So please, to at the same time, we are not the very big like a national project, but we could sustain it. And nationally, the ministry introduced so many kind of apps, the exercise apps, and also COVID-19 tracing apps. So this tracing app is a very less used by the people, because people don't like to give their private information. And then so here you can see one side is 2019 before the pandemic, it was like this. And then in the during the pandemic time, May 2020, I tried to work with the primary healthcare services, and you can see the Zoom. We use the Zoom and to organize the clubs again. And on the left side in the Zoom, in the first wave. And after that, okay, this is the first time we can make the exercise club in July 2020, because at the time the case number going down. So you will see that they became a little bit slow, and they also gain weight. Everyone with the mask and hand washing, and we have to change the place. The wider public halls, we hire this, and then in the Zoom, it is connected to another group. But this activity was gradually promoted. At the time, the second wave came again. Then we stopped for a while, and then in September, October, November, so we were very happy. Okay, continuously we could do it. And you see in fact, the one who is checking the balance she was the previous leader of such groups. So we can notice that she gained weight and a little bit slower. And then COVID, because of the COVID-19, the temperatures screening, and we also asked the history of COVID-19, wearing the mask, hand wash. So such thing, we need additional the procedure, and also the human resources. Previously, they can enjoy by times abound. Now we have to introduce a nurse, and also the healthcare some professional for the safety precaution. So it is very important to prevent the frailty crisis. So at the same time, because so many people have to go to the long-term care services during this COVID-19, and the care service home are full, and that places are also at the risk of the cluster infections. So it is very important to introduce the measure to prevent the frailty. So this is our challenge, is that, in a country like Japan, you may imagine that many people are using the internet and a mobile phone. But if you look at this is a gray digital divide. So younger generation, yes, most of the people use almost 100% of the age 20, 30 and can use the internet. However, over the age 60, 69, if you see the table on the left side, so internet usage rate is very low. So then, we are now thinking about how we can create digitally inclusive, healthy community. Not only the healthy and digitally, without a digital inclusion, it is very difficult to create the health promotion in the coming years. So then, now this is the last November. That after this club, we have to stop again because of the third wave, and now we could not resume again. So So now the good point is that using the Zoom, we can link to the people in a little bit far area. Previously, only the neighborhood meeting. Now we have a network of the primary health care clinic from this city to another city. And so we have to create a kind of wider room, good ventilation, so a little bit cost. But now we can sustain it. And I was very happy to have such a increasing number of the participant. And then in last December, so we were facing a new strain of the virus. The hospital were overburdened, and we stopped again. Until now, I could not resume this activity across the city. So we hope that we can make it soon, and with the vaccine and control better containment of the pandemic. So here, they used to do with themselves and with the LCD screen connect to another city, linking exercise in the Zoom. So okay, then we will see what will be the possible the challenges. And I show you so many lively places in Tokyo, but this place is in the eastern part of the Japan. So when I visit there for the long-term care project, in front of this small village is the deep sea. So once upon a time it was a port. So on that house, we met a 92 years old gentleman. He lived on that house. And then, in such an area, actually, not only 1 out of 4, perhaps 1 or 2% are old. So less population, more older people. And the problem is the health care service professionals, the doctor and nurses are also few over there. And the system of the healthcare service is the insured by the central tax, as well as some of the health promotion is usually not by the health insurance or long-term insurance. It is by the local tax. In this area, it is not like Shibuya or Tokyo. So collectible revenues from the local business is less than the uh, capital area. So this is a challenge, that how to bring this sustainable the health promotion as well as the healthcare services to such area which traps the between the sea and the mountain behind. So the possible inequality is across the higher and lower income status. Even the major health programs are insured. They still have to pay like 10% of the healthcare services. That's not so easy for some poor people. And across the municipality with different incomes, so there can be some inequality. And number 3 is the gray digital divide. So what we are doing for the next step is, in such an area, would it be a good idea to create a health system with the robot doctor and AI-based health promotions? We are thinking that in the In Japan, it is called the mimamori. Mimamori means somebody look after you. How are you, Dr. Donor? So every morning. Have you had your breakfast? If I don't see you today, I start to be asking about you. Such kind of culture is in Japan. So can we create it using the AI? So we're thinking about this for these kind of faraway places. So this is another project we're thinking, and many people in Japan is trying to make it happen. And so in the conclusion, I think that for the coming future, digitally inclusive, healthy aging community, which is very important. And how can we empower the older person and also their families to be digitally inclusive and get the healthy aging advantages. So after this, if the audience from the United States and around the world, so if I can get your comments and suggestions, that will be very nice. And this is the Sakura, which is coming soon, perhaps the next 2 weeks. In the coming 2 weeks, so I hope that people will not catch the COVID-19 coronavirus as well as they enjoy the Sakura. So thank you very much for your attention.